In this post-pandemic landscape, we are at the crossroads of financial distress, staff shortages, and an unprecedented increase in workplace violence, while at the same time, there's an uptick in construction of clinics and skilled nursing facilities. So it's more important than ever to have a solution provider with deep healthcare expertise and a proven track record of success. Whether it's a large, complex hospital campus, a nursing home or clinic, a long-term care facility, or a continuing care community, nothing motivates Johnson Controls more than providing a safe and healthy environment for patients, residents, visitors, and staff. And of course, the buildings and the assets in them deserve the best protection too. JCI has always led the industry with focus on safer facilities, and we want you to know that we have a modular suite of offerings that work well individually or together to protect you. Recognizing that healthcare security comes in different shapes and sizes, we have used our expertise as a global integrator with feedback from healthcare professionals to create a holistic approach that offers solutions to multiple threat levels across the healthcare continuum. A customizable solution set is yet another way JCI is making it easy for you to be cutting edge, and we have creative funding options to help you. How, you ask? By using JCI's combination of preventive and response solutions that interconnect to help automate processes and improve workflows. A solution set designed specifically for the unique needs of healthcare that encompasses everything from indoor air quality, staff duress and water prevention, parking lot security, to body-worn cameras, access control, intrusion detection, and video management, along with Security Operations Center as a service. Let's look at the security challenges in the day of the life of a hospital, understanding there are many similarities that apply to other types of healthcare facilities. We'll walk through the typical security threats as we piece together a bundled solution that addresses the critical issues of facility preparedness. Employees pull into the parking garage ready to start the day. They appreciate the good lighting and immediately recognize the blue emergency call boxes strategically located on the parking deck, along with security cameras throughout and near the elevator and stairwell entrances. Employees feel safe and confident to continue to the entrance of the hospital. See what happens as Nurse A enters via the emergency department. The outdoor cameras and video surveillance solution, powered by AI, provide clear video footage to the security personnel in the Security Operations Center of who is coming and going, suspicious activity such as loitering, a fall in the parking lot, after-hours movement, and more. Without stopping or having her bag checked, Nurse A happily and quickly passes through an advanced weapons detection scanner along with everyone else entering the ED. Behind Nurse A is a visitor who triggers the alert on the scanner. Security personnel can see on the scanner's monitor where the potential weapon is on the visitor's body and are able to pull the visitor aside to advise them of hospital policy regarding weapons and to take appropriate action. Nurse A is relieved that a weapon has been stopped at the door. Meanwhile, in the behavioral health unit, vaping, threats of violence, verbal abuse, and aggression are concerns that clinicians and other staff deal with daily and are often prevalent where surveillance is not permitted or common. So let's solve it before something happens. JCI uses smart sensors to pick up vape detection, THC, and many other indoor air quality measurements. And with our aggression detection, spoken phrases and safe words instantly and hands-free notify security of a situation and its location. It's a straightforward fix that solves a big problem. Throughout the building, utilizing touchless and contactless technologies allows new opportunities for a facility to maintain its hygienic best practices. Frictionless door control for sensitive areas like labs, pharmacies, and isolation rooms help to improve infection control. Mobile credentials for touchless entry eliminate the need for ID badges, and visitor management for visitor and contractor tracking can help reduce administrative involvement and automate processes at entrances and exits. Zoom into the mother-baby unit where moms and families have peace of mind knowing their newborns are protected by an infant security system integrated with access control, intercom, elevators, and video management to ensure that some of the most vulnerable patients are secure. This same system architecture can be expanded to protect assets from loss and to keep wandering patients secure in their space. On the third floor, a situation between an upset family member and a caregiver is escalating. The caregiver presses the staff duress button attached to her ID badge. Immediately, other staff on the unit and security are notified of who pushed the button for help and from where. The team members jump into action to use their de-escalation training to bring the situation under control and protect the caregiver and others around. Other options for staff duress include alerts from integrated hardwired panic and wireless duress buttons, emergency buttons on computers, and emergency buttons on computer keyboards. The output of the alerts can be a pop-up message on other computers, a notification on mobile phones, and in the security command center, or even automatically alerting the nearest staff. All the while, the events are recorded in a database for further investigation. Helping to prevent workplace violence is a game changer. Checking in on the IT and technical team's daily tasks. Not all security threats come in physical form. Cyber threats and attacks are rapidly becoming one of the most common and detrimental risks faced by today's healthcare environment. Protecting the privacy and security of health information is an absolute priority. And with the majority of patient health information being stored digitally, the need for cyber protection and HIPAA compliance assessment grows more prevalent by the day. Understanding your organization's risk is key in determining the best plan for patching vulnerabilities in your network and ensuring compliance with regulatory bodies. All of these solutions and technologies are made stronger and better when wrapped in the blanket of services like preventive maintenance and monitoring. But that service program needs to be created especially for you and considers elements such as your own capabilities, expectations for response and repair, risk assessment, monitoring requirements, and more. At JCI, we acknowledge that no two healthcare facilities are the same, but our expertise in security and integration allows us to provide a tailored solution just for you. Your facilities, people, and assets come first, and Johnson Controls will work with you to flatten the curve in healthcare facility violence and security risks.